Deep vein thrombosis is when a patient develops a large blood clot in one of the veins. Usually it's in the lower extremity or the leg. The most common signs or symptoms from DVT or deep venous thrombosis is swelling and pain in the leg. As the deep venous thrombosis becomes more severe and the swelling progresses, the patient will actually get redness, stiffness in the leg. And the complication from the deep venous thrombosis is if that blood clot breaks loose from the leg and moves into the chest or the heart and lungs, which is called a pulmonary embolism, and that's when the deep venous thrombosis or DVT becomes fatal. The treatments for DVT dating back to the 1950s originally involved initiation of blood thinning medication, so not blood clot dissolving medication, but blood thinning medications such as injectable medications like heparin or Lovenox more recently, and then some older oral pills or oral medications for blood thinning such as Coumadin or warfarin. More recently we have a device called the Trellis system, which is a catheter designed to trap the clot between two balloons, infuse the blood clot dissolving medication within that closed space so the patient's not being exposed to the dangers of blood clot medication through the entire body. It's not systemic, it's localized. And then using the catheter to kind of help break up the clot and then augment aspirating or removing the clot from the vein or the body. So this is the actual Trellis device here. It's a device that's designed to go into the vein in the leg. It's done percutaneously, meaning we puncture into the vein with a needle. And when this puncture is made into the vein, we pass a wire then from the skin entry into the vein through the blood clot, and this device is then fed over the wire into the vein within the clotted segment. Now, the way this device works is once it's inside the vein, over the wire, the tip of this device is, and it comes in different lengths, so the very tip or the distal end of the device has a balloon which we can then inflate. And what that does is it prevents the clot from moving more proximal or central into the body once the balloon is inflated. Then there's a second balloon on the back end of the device which we can then inflate, as you see here. And this balloon on the other end of the clot kind of traps that clot within this segment here. Once the balloon is inflated and the clot is trapped between the two, we know that the clot won't accidentally move out of this space and potentially go to the lungs and cause a pulmonary embolism. Once we have this space closed off, there's small holes in the device here through which we can then inject a blood clot dissolving medication. So this is through this syringe here once these two balloons are inflated. As the blood clot dissolving medication is infused within this space, we then activate this catheter. This catheter then can actually act like a blender, whip the blood clot dissolving medication inside the vein. And so as I activate this here, you'll see this is at a low speed activation. It's what we call a sinusoidal action, where it's whipping around in a curved fashion. As we increase the RPMs, or revolutions per minute, you can see it creates almost like a vibration within that segment here. The balloon is still keeping the device trapped. We usually run this for about a minute at a time, and then after 1 minute we change the position of that sinusoid. See, here it's being moved more distally, or after 1 minute we can move it back more proximally. And after several minutes of treatment, we then turn the device off, and through a larger syringe, which is the aspiration syringe here, we can actually then aspirate or suck or vacuum the dissolved clot material, softer clot material, out of here into the syringe. And we would do an angiogram by injecting X-ray contrast into the vein. If there's still remaining clot, we could repeat the process over again. So there's usually not much pain with the procedure. If there's any discomfort, it's usually because the patient has to lie on their stomach during the procedure, since we're entering the vein behind the knee and the back of the leg. With the treatment like this, the patient can usually return to normal activities, normal lifestyle relatively fast. Usually 2 days would be the earliest. Sometimes patients are in longer if they've had complications before they come in, if they've come in with a pulmonary embolism already, and we have to treat the problems with the shortness of breath and the chest pain from the clot that's already gone into the lungs, those patients may need to be in for 5 to 7 days.
For more information, call 1-800-GS-CARES. Good health to you.